Hello, and welcome to our Dental Implant Seminar, Creating a Smile for Life. I'm really excited to introduce to you our speakers today, Dr. Parikh and Dr. Reddy. Dr. Parikh is a third-generation medical professional that has been practicing general, family, and cosmetic dentistry for nearly 20 years. He is California licensed and a proud member of the American Academy of Implant Dentistry, as well as the Global Dental Implant Academy. Dr. Reddy graduated from dental school in India in 2009, and after 3 years of practicing general and cosmetic dentistry, she came to the U.S. to pursue her DMD at the University of Pennsylvania School of Dental Medicine, and in 2018 graduated with honors. Cosmetic dentistry is Dr. Reddy's passion, and she is also a member of the American Academy of Cosmetic Dentistry. Here at Ascot Family Dental, we've been seeing implant patients for over 10 years, and we've treated over 500 implant patients. It's now my pleasure to introduce to you Dr. Parikh.
I'm glad you guys were able to watch this video. We were really excited that you're getting a chance to watch this video. So let's get started talking about implants. So I'm going to start with my mom's story. So, my mom has a very pretty smile. I make sure she comes to dentist, she comes here, she gets her teeth cleaned, and she's really proactive. She gets her teeth cleaned routinely. She keeps good oral hygiene at home, and I make sure she's on a regular hygiene. Now, one day I get a text and a picture. She says my tooth is broken. So here's the picture, and and all she said was she was eating berries and she bit down on a seed and a front tooth broke. Now, I knew that my mom does tend to clench and grind her teeth, so I have a feeling that's what had caused that. So the bad news is that right after this happened, within a week, we were going to go ahead and fly to a cousin's engagement ceremony. So it was pretty bad timing, and it's always is a bad timing, right? It's always is a bad timing when stuff like this happens. Now, traditionally, what happens in this case is we make a bridge. What is a bridge? Bridge is where if the tooth is missing, we shave down 2 adjacent teeth and make a 3-teeth bridge. 3-teeth bridge basically are 3 porcelain crowns. The last 2 crowns anchor onto the natural teeth, and it's fixed. Now, it is not the best treatment options. We'll look at it a little bit later in the presentation. Because what happens is when we grind on the adjacent teeth, it causes damage to the adjacent teeth. So this was really not the best option, and obviously my mom knew a little bit about it, and she was not really happy that she was going to go ahead and get that. Now, tooth loss is pretty serious. Now, before we talk about what's going on with my mom, let's look into this topic. Why is tooth loss such a big issue? Let's look at some statistics. What causes tooth loss? There are 3 reasons what causes teeth loss: gum disease, trauma, and cavity. US population currently is about 318 million. People missing all their teeth is 40 million. And people missing one or some of their teeth are over 150 million. So there's a lot of these people are suffering from this problem where they either are missing one teeth or many teeth. So this problem is real. This problem needs to have some solution, which is a good solution which patient is happy. So the same questions all of these people have, same question my mom had is there no other way that these patients today can achieve their sense of wholeness back, eat the food they wish to eat, and without any speech alteration? And the answer to that question is dental implants. Dental implant is that breakthrough technology through which patients can get all of that. What is dental implant? So dental implant is nothing else but a small metal post that is used to replace a natural root of a tooth. The dental implant serves as a base on which a crown is anchored on. So let's look a little bit more into dental implants. History. Dental implant has been around since 1950s. Dr. Panoramic in Sweden was the one who first introduced dental implants. They found out that there was this material called titanium that our body takes it really well. They initially tried it on doing implants for the knee or the hip, and then they used the same material for the teeth, and there was a success. In 1965, first dental implant was placed in the patient's mouth in Sweden, and in 1982, implant treatment was established as a mainstream treatment in United States. So anytime patients have missing teeth, whether one or multiple, there are 4 options. No matter where they go, there are always 4 options. Option number 1 is implant, option number 2 is bridge, option number 3 is denture, and option number 4 and last option is obviously don't do anything. Option 1 and 2, implant and bridge, those are fixed options. Fixed options meaning the teeth stay inside the mouth, they don't come out. Option number 3, removable denture or no treatment, are the options where the teeth they do come out, and in no treatment obviously there are no teeth. So let's look at what are some of the drawbacks of other options. Obviously this is implant seminar, so we're going to talk about implant, but it's not just because it's an implant seminar I'm going to talk more about say good stuff about implant, but actually implant is one of the best treatment. Let's look at all the different options. Let me explain you why implant is one of the best treatment. To understand that, let's look at some of the drawbacks of other options. First option is bridge. As I talked earlier, bridge is an option where we grind 2 adjacent teeth. So those 2 adjacent teeth, they are in pretty good shape. However, still they need to be ground down so that a bridge can get a support. So one of the bad things is those 2 nice beautiful teeth are getting ground down. The second disadvantage is bridge is a lifespan of about 8 to 10 years. That means after about 8 to 10 years, typically patients do tend to get some decay starting around that crown. Now again, this is an average. That means a lot of patients, they have excellent oral health and they never need to replace this bridge, but on an average every 8 to 10 years we notice patients starting to get cavity around the bridge and they need to be replaced. So if we are doing this replacement, after a couple of replacements, then the third time when the bridge needs to be replaced, the decay has gotten so bigger that by that time patients lose the tooth. So that's why it is not a good option. Look at the options of partial or complete denture. With full or partial dentures, there are also major drawbacks. These drawbacks, I'm going to go ahead and kind of look into 3 different areas: cosmetic, function, and psychological. Cosmetic consequence. So when a patient has dentures, what happens is when we chew our food, our teeth basically they stimulate our jaw. But when the teeth are gone, our jaw does not get stimulated, and because it does not get stimulated, it slowly and gradually starts shrinking away. And as jaw shrinks, our facial symmetry, our facial features, they do start changing. So what happens? Our front teeth, when you start losing your back teeth, our front teeth kind of flare out. As our front teeth flare out, the corner of our mouth starts drooping down. Also what happens is our nose, it starts going down, chin starts going up. Okay, so let's look at the cosmetic consequence. So what happens is when our teeth have a purpose of chewing. When we chew with our teeth, what happens is our jaw is constantly getting stimulated. But when we have missed, or when our teeth are missing, our jaw does not get stimulated. And something that does not get used starts atrophying. Atrophying means it starts shrinking. As our jaw starts shrinking, our facial features change. Our front teeth flare out, the corner of our lips starts drooping down. What also happens is as our jaw shrinks, our muscles, facial muscles, they have to stretch and do all this different thing to compensate for chewing, and because of that we start having wrinkles on our face. Also what happens is as our front teeth and upper and lower teeth jaw starts shrinking, the nose starts going down a little bit, and chin starts curling up. So you can almost look at how the features over here. So our jaw size decrease. It starts giving you older appearance. Other thing that happens is lips. You can start seeing as if the lips are starting to get flattened. In this picture you can see the lips are fuller, but as we get to different pictures the lips starts getting flatter and flatter. These are some of the pictures. You can see what is a dramatic difference when patients don't have teeth. So it is really dramatic change when patients don't have teeth. It really adds to the age. We talked about cosmetic consequence. Let's look at the functional consequence. So when patients wear dentures, as I mentioned, dentures don't stimulate the gums, so bones shrink and gums follow the bone, and that's why the dentures don't fit well. Even though dentures are fitting well on day one, as time passes by, dentures don't fit well. Ill-fitting dentures, it gives us really hard time, or gives patients really hard time chewing properly. They are not able to chew properly. The food does not get digested properly. They start having tummy problems. Other thing also happens is because they are not able to eat all kinds of food, what happens is the nutrition gets compromised. They are only eating certain softer food which does not all the time have nutritional value. So they start having other health related problems. Let's look at the psychological consequences. So continued struggles with ill-fitting denture a lot of time leads patients to just give up. They're like, hey, you know what, I just give up, I don't want to wear the dentures anymore. And their self-esteem plummets. They start staying away from social scenarios. They avoid being in front of people. There is always inconvenience and social stigma that accompany that. Even a lot of these people go into personality changes, chronic depression, and a lot of this stuff keeps on happening. So our goal of the modern day dentistry or modern day implant is to bring these patients back to oral health in predictable fashion. Implant treatment not only stops bone loss, that's the biggest thing about implant treatment, it stops bone loss, but it not only just stops the bone loss, but also stimulates bone and maintains the jaw size. Facial features are not compromised, patient's chewing is not compromised. So there are a lot of great advantages of implant treatment, and that's why implant is one of the best options available right now in market to replace your natural teeth. Look at my mom's story. Today, after getting her single tooth implant, mom enjoys her healthy and vibrant smile without being self-conscious. What I'm going to do next is I'm going to go ahead and bring on Dr. Reddy, and Dr. Reddy is going to go over and talk to you guys about are implants right for you. So let me welcome Dr. Reddy.
Okay, hello everybody. I'm Dr. Reddy, and I am going to talk about are implants right for me. That's a question, very common question we hear. Is implant a solution to everybody? The answer is not always, no. There are some medical considerations, some dental considerations, some psychological considerations, and financial. Okay, let's dive into the next one. Dental considerations. So like tooth is supported by the bone around it and the gums around it, similarly implants have to be supported as well. So if the bone is not good enough or the gums are not good enough, then implants not going to stay for long, or you might not even be a ideal patient for it. We today have a lot of grafting available. We can graft the bone, graft the gums around it, and then build it up to a level where we can go ahead and place implants. But that is not always the case, and not always we can graft that much of bone, and not always that you can, it's more steps added, more money added to it. So, there are some limitations to it based off of bone and gums. The next one is bruxism. Okay, if it's somebody who's a mild bruxer, somebody who has just started bruxing, then we always suggest, after the implants, we can go ahead and give you a mouth guard, and, we can still go ahead and do implants on them. But if someone's bruxing for a long time and they have a lot of broken teeth, then that patient might also break the implant as well. So that's a contraindication as well. The next one is adequate access. What that means is if the tooth is all the way to the back, the tooth that is lost is all the way to the back and we have to place an implant, then we need a certain amount of space to get in and place that implant. And in other case, patient might not have the best mouth opening, so might not be able to place implant in that person as well. Okay. The next one will be medical considerations. One, it's pregnancy. So during pregnancy, we postpone all elective procedures to later. If the patient's having infection, then at that time we take out the tooth, but we have the patient come back after the pregnancy is done to place the implant. Okay. And the next one would be some of these advanced skin diseases, pemphigus, lichen planus, the list goes on. And those conditions, there's an altered immune response, and also bone is not the best in those patients, so that's one of the contraindications. Okay. And next one will be malignant diseases. In this, the patient is so immunocompromised that placing an implant will be an absolute waste, because most certain that patient is not going to accept an implant in those cases. Okay. And these are the absolute contraindications. And next, what I dive into is relative contraindications. What that means is if implant is very predictable, okay, what that means is the success rate is about 95%. Okay. That being said, here relative contraindication means that success rate dips down slightly, which is about 80 to 85%. Okay. And one of the most common ones is smoking. So in smoking, what happens is the blood vessels get constricted. So the amount of blood flow to that area where we place an implant, the bone, in order for it to get integrated with your implant, it's really necessary there's a really good blood supply, and that's not the case. So the failure rate is higher. So you need to really think about cutting down on smoking to give the best results with the implants. Okay. And next one would be diabetes. Not all diabetic patients have failure rates with dental implants. It's the ones who have uncontrolled diabetes and hemophilia, epilepsy, impaired movements, and some of the heart conditions, bronchitis, emphysema, liver disease patients. And there's also an impact of age. I'm not saying someone who's older cannot get implants. That's not the case. Even a 99-year-old person can get implants, but it's the lower limit. What a person who is under 18, generally, they are still growing. So at that time, we don't place implants, but because the patient is still growing, so we let the bone to completely, grow to a certain extent, and then once the growth stops, that's when we place the implant. Okay. And next, the psychological limitations. So one question I want you to ask yourself is, are my expectations realistic? Is it that I'm trying to just get a tooth that works well, looks good, and functions well? Or is that something that I'm expecting? I don't have an idea what I want, or two, something that you yourself don't know what you want. That's something, we'll have to talk and decide whether that's the route to go, because you might not be happy whatsoever we do in order to get a success there. Okay, there are some 5 factors which stops a patient from coming to the dentist, and it's the same 5 factors with the implants too. One is fear, time, budget, no sense of urgency, and trust. So the first one is fear. Okay, if you hate coming to the dentist, you're not the first person. It's 140 million people out there hate seeing us. And I understand, and I think we've cracked the code on how to handle this. So fear. So patient. One thing that is the reason behind why you have the fear is you have a fear that you are not under control of something that you're getting into, and this is what we say to our patients: you're always in control. You say stop, we stop. We always say before we get started, raise your left hand and we're gonna stop. And you always are in control, okay? And the next thing is we numb before we numb. What that means is patients are scared of needles, so we have really good topical application gels that we can place even before we give an injection. That makes it so much more easier for you to handle the procedure. And then we have laughing gas. So it's the nitrous that we give during the procedure. It's going to calm you down. A lot of patients really benefit from this. It's going to keep their anxious levels low. And next is, we give some noise cancelling earphones. That's going to kind of take your mood away. If you're a person like me who loves music, then that's going to be the perfect solution. And next is oral conscious sedation. What that means is we're going to give you a couple of, pills. You take one before the day of surgery and one hour before the surgery, and that's gonna put you at ease. Only thing would be there's someone who has to drive you, take you back, because you're really not gonna know, or it's gonna be like a hazy memory or a dreamlike state that you're gonna be in. And a lot of patients do really, really well with this. I've heard stories about how patients come back to pay their dues even in spite of paying it on the day of surgery. So, there's some things that we hear, all these stories. People who hate injections or people who have hard time getting numbed up, person who is a gagger, person who's got sensitive teeth, or if you are one of those people who want everything to be done in 1 to 2 appointments, this is a perfect solution. I'm gonna go to the next. So like I said, it's not just you who's scared of getting implants. There are so many people. If you go into our website or go to Google, there are tons of reviews which all say I was really scared and I was made comfortable. It went so easy, and it was a very healthy environment, and doctor is a perfectionist, and even before I realized I had my implants placed, it was great. Extraction went easy. So some of those things, it might make you feel better to read these reviews, because it's not just you alone in this boat. There are a lot of other people who are going through the same phase, and it might just make you feel a little better about it. Okay. And next, I'm going to talk about is time. So a lot of people don't come to a dental office because it doesn't work with their work timing. But we are open Monday to Saturday, 7 a.m. to 7 p.m. We are open 2 Saturdays a month. We do dentistry in a very efficient manner. We try to get most of the things done on one side at a time. That way it's just, faster. We can do treatments in a very few visits. Next point I want to bring up is no sense of urgency. So today you might be, I like to do my dentistry, but nothing hurts me. So there is no reason to visit us in the office. This is something that I hear very often. What I can say is it will never cost less or hurt less than today. It's the best time to get something done is today. And for example, if you were told that this tooth is not savable and best thing to do is implant right away, and you think about it, and then either there's a lot more infection, lot more bone loss that goes around that tooth, so that will need bone grafting or waiting for 3 months to get an implant. All those extra steps that get added, if you get it done that day or while you still have all that bone. You saw all those previous pictures, right, where people kept losing their bone, and you might even reach a state where you're not a good candidate for implants. So today is the best day. And this is what I was telling, initially they had plenty of bone, but as time went by, their bone got atrophied and they didn't have enough bone to get implants done. So it's not a question of if, it will happen, but when. Next, I'll talk about is budget. And I know this is one of the very important deciding factors about implants. It is expensive than the other treatments that are there, but I can tell you that it is in a long run, you're gonna be thankful about this treatment because it's the best that's out there. We have a lot of options that you can go with to make it more affordable to the patients. One, we offer flexible payment options. So we have Care Credit, where you get 12 months of interest-free payment option. And then there is the Lending Tree Club, where you have extended payment options, that is for 18 months, 23, up to 72 months. That gives a lot of time for you to make payments. And then the other thing that we always do is stage the treatments. You don't have to get everything done at one visit. We can focus on the one that is a priority, stage it out for next year to do something else, and the following year. That way, paying gets easier, and also you're not losing a lot of function. We are staging it without losing many things. Insurance discounts, great. We have great treatment coordinators. They'll give you many options in terms of they contact the insurance, see what they're paying for. When it comes to implants, it's more than a basic treatment. They might pick up maybe placement of implants. Sometimes they might pick up crowns. So we'll try to fit in such a way that we get maximum from the insurance without it being too much on you. And the other question rises, okay, I don't trust the dentist at all. So we can be your coach and guide you through what are the best options that are out there, okay, than telling you what to do, okay. So we'll give you, we are not trying to sell any treatments here. We are just laying out all the options, and we let you choose, let you choose what is right for you, okay. And we are responsible for presenting options to educate you, and you get to decide if it makes sense to you. And I'll let Dr. Parikh take over, and he's going to talk about, the process of implants and kinds of implants that are out there.
All right, so we're going to look at some different typical implant treatment options that we have. So first implant treatment option is when you have a single missing tooth. So when you have a single missing tooth, you need single implant. That's one of the most common options. The second option is where you have one or more teeth missing. Say you have 2 missing teeth or 3 missing teeth. You can either get multiple implants, or in case you have 3 missing teeth, then you can get 2 implants and a bridge. Now this implant bridge is better than the natural bridge, is because implants do not get cavities. So there's not really any reason that you need to replace this every 5 to 10 years. So this is different than a traditional bridge. The third option is where you have pretty much all teeth missing in the jaw. When you have all teeth missing in the jaw, there are 2 options that are very common. Option number 1 is called implant supported denture, where we give 4 implants and a denture that snaps in and out. So that option gives some sturdiness to the denture, that denture does not flop out. At the same time, it is very cost effective. The other option for the patients who want everything fixed is called all on four. All on four is where we put the implants in and the denture goes on, and it always stays on. So those are some of the typical implant treatments that we see in our office all the time. We're going to go ahead and now talk about how it works, like what is the actual process, what are the appointments, how it works, like step-by-step process. Appointment number first is initial office visit or consultation. Appointment number 2 is typically the day of surgery. The third appointment is about 2 weeks later. We'll go ahead and do a follow-up check, make sure everything is doing good. Appointment number 4 is where we do the impressions to make your final teeth, and appointment number 5 is your final teeth, whether it will be one or multiple. Now, after this is all done, we typically want to see you for your maintenance visits, and we can talk about that maintenance visit at the very end. So let's talk about each of this visit a little bit in depth. The first visit is initial office visit, and at this point we are basically looking for what is going on, what made you come to us. A lot of time patients have been using Fixodent, Polygrip, and all these different denture adhesive cream, and they're just sick and tired. They want something that does not come out, that stays in, and it's comfortable for them. A lot of time is just like in my mom's case. She was eating and she just broke a tooth. So we find out what's going on, why you were here, what are you looking for. We check your medical history, dental history, we educate you, and a complete comprehensive exam is done. At the same time, in our office we have a 3D scan that gives us a very good information on all the vital structures that are present. This way we can place implant very accurately. Now this is called Panoramic X-Ray. You can see in the slide over here, it's a 2-dimensional X-ray. It is good, but nowadays technology has advanced so much that now we also have that third dimension, and it is very critical because it makes implant foolproof. It is very accurate and the chances of error are very less. Very few dentists in Roseville have this machine available. It's called 3D CBCT, and our office, luckily, we are one of the very few offices that do have it. And this way patients don't have to go somewhere else. If you are here, we get the whole thing done right here. So like I was saying, it gives like a third dimension. It helps us find out exactly, precisely where the nerve is, where the sinus is. So this helps us in choosing accurate implant, size, and placement. We review the scan at the same time, and we decide on what are the steps. Are we going to go ahead and make you 3 individual implants? Are we going to make you 2 implants in a bridge? Are we going to make you implant supported denture, or are we going to do something else? So we're going to talk about all these different options that you have. We can also talk to you like, are you going to need grafting, or are you not going to need grafting? What are the pluses and minuses? We discuss cost of the treatment, and our financial coordinators goes over all the different payment options that we offer. And once everything is all squared away, we make an appointment for your day to come in and get the implant done. So that's the day of surgery. What do you have to prepare for the day of surgery is depending on your individual medical history. If you are somebody who is on blood thinners, we typically ask you to check with your medical doctor. Some medical doctors say go ahead and stop blood thinners. Some medical doctor would say no, that's very important, I want you to continue on blood thinner. So we leave that part on your medical doctor. We also want you to sometimes start antibiotics an hour before you come in. We'll give you antibiotics and pain medication that you start an hour before coming in. Sometimes we're going to also prescribe you corticosteroids if the implant surgery is pretty involved. As far as smoking, we tell patient that it's very important that you stop smoking at least for 15 days or a month. Okay, this is a perfect time for you to quit smoking. What a better, like there's no better excuse than this. You're getting dental work done, this is the perfect time to quit smoking. Foods and liquids, depending on if you're getting stuff done while you're completely sedated, you're completely out, or if you're doing under local anesthetic, typically I tell my patients, make sure you eat something and come, unless you're getting it under complete sedation, then you don't want to eat. But most of the time you want to eat and come, because after the work is done, we will typically tell you, you know what, you can only eat soft and cold food, and there's a lot of restrictions afterward. So make sure you eat something before you come in. So we anesthetize the gums, we make an incision, do our stuff, place an implant, take some stitches, and we give you some instructions. We basically will give you some instructions on what to expect, what kind of food to eat. Typically it is soft and cold food for at least a day or two. We'll give you ice pack, apply ice pack outside, at least for 20 minutes every hour for rest of the day. We'll give you antibiotics, pain medications. We'll ask you to take a certain period, and we'll let you know like how to take care of your wound. Typically we tell you just avoid brushing right around that area, but if we want you to still keep your mouth clean, just don't brush right where the implant were done. You should not be rinsing really hard on that day, but after about 24 hours you want to go ahead and start rinsing, keeping your mouth clean. We'll ask you to come back in 2 weeks for a follow-up appointment. At that time, if stitches were taken, we'll remove the stitches, we'll evaluate the healing. That's how it's going. So there are a lot of times, like Dr. Reddy talked to you ahead about limitations, and there are a lot of dental limitations where we have to do bone grafting. There are different kind of bone grafting. We're going to talk about it's autograft, allograft, alloplast, xenograft. These are all these different kind of grafting. Autograft is when we use your own bone. Allograft is when we use bone from cadaver. Alloplast is artificial synthetic bone. Xenograft is animal bone. So now we typically don't use alloplast or xenograft. Xenograft is animal bone. Alloplast is synthetic bone. Those two bones at least in our office, we don't use it. So that leaves us with two options: autograft, that is your own bone, or allograft. Allograft is basically cadaver bone. Now let's look at both these grafting options so you kind of understand what is it and what is involved. So autograft is where we use your own bone. There are certain, like, where do we get this bone from? We typically get it from chin or the back part of your jaw, or sometimes even hip. Now, advantages and disadvantages. Advantage of this is, yes, typically if we use your own bone, the success rate is higher. However, the disadvantage is you have to get a second surgery just so that we can get bone. In that site where we do surgery, you're going to have soreness. Sometimes you can also have numbing sensation that's going to last a little bit longer, which is called paresthesia. And typically, in short, a lot of patients nowadays avoid getting second surgery just because of the fact that we have come along so far in the dental technology that now we have grafting that is like allografts are really good grafts from cadaver bone. They are very safe. They get bone that is in powder format. Sometimes it is in putty format or liquid format, and they are very safe. So 9 out of 10 times, I would say almost 95% of time, what we do is we use allograft. It's pretty safe. There's no second surgery needed, and it is just as high success rate. A lot of time we have to do sinus grafting. Patients sometimes they haven't had implant, or they have lost their teeth for a long time and they just did not have resources to get the implant, and finally they are like, yes, I'm ready to get the implant. However, by that time they have lost so much bone that we don't even have enough bone to place an implant. And if it is upper jaw, we would have to go ahead and do bone grafting in the sinus, and we sometimes do have to do that. And sinus grafting is actually the very safe and predictable grafting. So that is something also we do it over here. Now let's talk about the healing phase and temporary teeth. So after implants are done, we typically ask patients to wait about 3 to 4 months. During this time, bone is starting to grow around the implant and making implant solid. This process is called osseointegration. That means bone integrates with the implant and implant becomes a part of our body. So typically we want 3 to 4 months. During this period, we have a few different options for temporary teeth. Obviously, the best option is not to have anything, because if you don't have anything, we are not putting any pressure on the implant. It heals faster, it is predictable. However, a lot of patients, they want something, especially if it is one of your front tooth that is missing. Like my mom, she wants something right away, and we were able to give her a temporary tooth, and she was able to attend that function I was talking about. So yes, we do have options of fixed temporary, that means a temporary that doesn't come out, stays in, or we have removable temporary option, that means we have a plate that you can wear during this 3 to 4 month period. Now, right after this, we're going to go ahead and, after about 3 month period, we're going to go ahead and talk about how does the impression works, and like how you get your final teeth. Let me quickly make sure. So the way you get the final teeth is that's appointment number 4. You come in, we take impressions of your teeth, and we send it to the lab. We take some photographs, we pick the shade, we pick the shape, size of the tooth, and then we'll send all the models to the lab. And about 3 weeks later, your new tooth is ready, and we cement it on. This is pretty straightforward. Those appointments do not need any anesthetic. You're in and out in no time. So let's look at the time frame as far as the treatment. Typical scenario number 1, when you're only missing one tooth, if we have to divide it in phase, the first phase is where we remove the tooth, place an implant, then we wait about 3 to 4 months. The second phase is where we take the impressions and whatnot and have you come back in about 3 weeks and deliver the crown. So total time period is about 4 to 5 months. The second typical scenario in our office where patients are missing all their teeth, we remove the teeth, place the implant, get the denture done. Typically that is about 6 to 7 months long. What happens is, first of all, step number 1 is we remove the teeth and make you an immediate denture. Immediate denture is something that you have the same day as the teeth are removed, you get new denture. So there's not a single day that you live without the denture. After immediate denture is given to you, we'll wait about 2 to 3 months, let the gums heal, and then we'll place the implant. Now, a lot of time we are able to place the implant the same time as extraction, but depends on how much bone you have, and we have to look at your x-rays and find out if that's the right option. So we don't want to promise that every time the teeth are taken out, we will put the implant the same time. And the last step is after about 3 to 4 months, where after the implants are done, we are ready to take impressions and get you the final denture. What I'm going to do next is we're going to talk about how it is to live with the implants, what kind of care do we have to take. So I'm going to go ahead and hand the stage back to Dr. Reddy, and Dr. Reddy is going to talk about living with implants.
Okay, so let's talk about living with the implants. So like your natural teeth, you really need to take care of your implants as well. Yes, you're not going to get cavities with the implants, but there is a chance. There's still bone around it, there's gums around it, so if you don't clean it, you don't take care of it, your implant's going to fail. So if you're a person who thinks, because I have to brush my teeth, I'd rather take them out and get implants, then this is not a good option, because you still need to take care of your teeth, okay? Implants, okay? So, so to prevent gum infection and bone loss, prevent the bad breath, discomfort, or any pain or any infection that might arise because of bad oral hygiene. And the more you take care of your teeth, take care of your implants or take care of your teeth, the longer it's going to last, okay? So you are going to increase and maintain your quality of life, including your ease and enjoyment of eating, speaking, and smiling. Okay, so basic is the best. All that you have to do is take that brush, put some toothpaste, brush your teeth, just like how you do normally, okay? And like you see here, there's a lot of plaque around that implant that is there, and that's not good. That's gonna start irritating those gums, and bone's gonna go with your gums under. And then there are quite a few options available. It's called Proxy brush. You get under those implants and clean everything up. And floss, that's a great option too. You can clean under really well, and this is what we highly recommend. There's the stream of water that comes from this device, splashes a lot of water and gets all that food out. It's called a water pick. And generally, when you come for your recare visits, the hygienist goes through plenty of ideas for you to keep everything really clean. So the time that you take to clean, it's much lesser than the time that you take to groom yourself. So spend those few minutes taking care of those implants, and those implants are going to last a really long time. Okay, and it's really important that you follow up with your hygienist. For the first year, we typically have you come back at least 3 times a year, and following to that, we can put you under 6 months recare visits. And it's always good to have preventive care. It's going to cost you much lesser. If we see something happening, like a screw getting loosened or a tooth decay that's starting, we can catch it at that time and not wait until the implant fails or the tooth fails. So it's important that you keep up with your routine dental visits. And again, like I said, there are plenty of Yelp reviews or Google reviews that are out there which are talking about what the treatment that we have done for the patients. Look up those. That's going to, one, help you with understanding what they went through and ease of it, and other thing, you're going to know, how the process involved in it, and some good things about us too. So just take a look at it, and it's gonna kind of put you at ease. Okay, and I'm gonna hand the mic over to Dr. Parikh, and he's gonna talk about some exclusive specials that are that are for the patients who are seeing this video today. Okay.
Thank you, Dr. Reddy. So we are pretty much at the end of the presentation. I hope this presentation was really helpful. It kind of helped you understand the process. I know there's going to be always some questions or some points that you probably need a little further clarification. So give us a call anytime. We do will get you in, answer those questions. Now, typically our goal today was to do like a live seminar, but because of the whole coronavirus thing, we're going to go ahead and we were able to do this video recording, and we'll send it out to you guys. So for some of the patients who registered for our implant seminar, we are doing some exclusive offer. So just in general, like if you're looking for this option where patients are missing all the teeth, or you want pretty much the rest of your teeth taken out, and we're looking at that option where I talked about, where we'll do implants and implant supported denture, something that snaps in and snaps out. Typically that option, it includes you have to come in for initial visit. There's a 3D scan involved, removing of the teeth, placing of the implants, first set of teeth, relines, and final denture. So the whole process, like I said earlier, was about 6 to 7 months long process. It typically cost about close to $18,000. But what we're going to do is, our implant special for this seminar is $11,999. That's a saving of almost $6,000. But again, this is not enough. We're going to go ahead and throw in a little bit more. If you need any bone grafting, which can cost easily from $500 to $1,500, we're going to go ahead and do that for you at no charge. Yes. So if you look at it, that's total saving of close to $7,500. Again, I'm not going to offer this to all our patients. We're going to only offer to selected few people who registered for this seminar. So that's the option if you're looking for implant supported denture. And again, because of the whole situation going on right now, we are going to go ahead and only extend this offer for 30 days. So what I would like you to do is, if you are interested, make sure you give us a call and make a consultation appointment before April 15th, and then we can go ahead and offer this option for you. Now, another exclusive special that we are doing is for single tooth implant. If you are missing one tooth and implant needs to be done, typically it involves initial visit, 3D scan, implant placement, abutment, crown. The whole thing cost about $4,844. but we are doing this special of $29.99. So that's a saving of close to $2,000. But like I said, that's not enough. For the people who are registered for this seminar, we are even going to go ahead and do the extraction and bone grafting at no charge. So if you're missing a tooth, or if tooth is broken that needs an implant, we'll take the tooth out, do the bone grafting at no charge. So the whole thing, that's probably savings of $26.95. That's like a 50% saving. That's really good. So like I said, we are only going to offer it for a limited time only. So April 15th is the last day. After that, I will not be able to honor this. So thank you so much. This is Dr. Reddy and Dr. Reddy's husband and daughter, and this is my family. Thank you so much for paying attention and listening to us, and we hope to see you soon. Thank you.